Welcome to the London InterCommunity Health Centre's Safer Opiate Supply Program. People who use drugs have been calling for safe supply for decades. They want access to a regulated drug that is of known quality and strength. When people rely on buying through the illegal drug supply, they don't know what they're getting. They don't know what's in it, how strong it is, or what effect it'll have. These days, the illegal drug supply is extremely unpredictable and toxic. This puts people at harms like infections, overdoses, and death. In 2016, we really started to see the impact of the contaminated drug supply in London. Our community members were experiencing more overdoses, more harms, and more deaths. Something had to be done. We started providing a small group of people who were at very high risk of harms with a prescription for hydromorphone tablets. Every day, they would go into their pharmacy, get 1 day's worth of tablets. Many also take a longer-acting opioid like slow-release morphine or methadone as well. They take this longer-acting medication at the pharmacy as an observed dose. We saw people doing amazingly well. Their substance use started to stabilize, they became more engaged in healthcare and social services, and they started to report feeling better. We formalized and expanded the program in 2020 when we received funding from Health Canada. Today, we have 350 number of clients who receive safer supply, primary care, and wraparound services. When we talk about safer supply, we are talking about a harm reduction approach that helps people reduce their use of drugs from the unpredictable, contaminated, illegal supply. The goal is not treatment or abstinence. The goal is to provide a drug of known quality and potency so that people can manage their substance use as safely as possible. A second goal is to offer clients access to primary care and wraparound supports to help them with their self-defined goals. Come with me, meet the team, and see how we do safe supply at LIHC.
Hi, I'm a team member of the Safer Opiate Supply Program. Today we will explore the path that is taken by a client at the health center for their scheduled appointment. Typically, clients are assigned a day and time, either AM or PM, during a weekday, and are expected to regularly present to the clinic during this time in order to secure their prescriptions for the following week. Most prescriptions are written for 8 days, so most clients have medications available already for their day of their appointment. This is our waiting room. We try to make this room a friendly, welcoming space and have lots of resources and supplies on hand for people. Some people tell us exactly what they want. Other times, we just put together a general bag of the most common supplies. Typically, this would include toothpaste, a toothbrush, soap, shampoo, toilet paper, combs, and feminine hygiene products. Depending on the season, we will often have extra supplies as well, such as sunscreen, chapstick, hand warmers, winter hats and gloves, throat lozenges, etc. We also have a list of food banks and a calendar of where people can get meals on which days. We also provide harm reduction supplies. We offer 2 types of syringes. The 1cc and 3cc are what clients will ask for. We also have safer inhalation kits, foil smoking kits, safer crystal meth smoking kits, and condom kits. We document what people take. Clients make up a unique code for themselves that they use to protect their confidentiality. Some of our clients use a health center as their mailing address, and this is the place they come in to get their mail. The most typical kind of mail people get here include ID and government checks, not personal mail. We keep the mail in a cabinet and have clients sign that they've received it. Our team sees every interaction between clients and staff as an opportunity to build relationships and find out how best to provide what that particular individual needs and wants. We recognize that a friendly, non-judgmental face is as much as a basic need as food and socks. We try to keep things as low barrier as possible, keep things simple, follow the client's lead without pushing anything on them. It's their choice after all.
Hi, I'm a lab technician. A medical model of safer supply fosters collaboration between clients and healthcare providers. We follow a harm reduction philosophy, and we try to be as low barrier as possible to provide client-centered care. In healthcare, there are best practices that we are expected to follow when providing certain types of care. In the cases of prescribing opiates as safer supply, one of those practices is urine drug screens. Part of the agreement clients sign when starting on the Safer Opiate Supply Program includes consenting to regular urine tests. We know that many clients come to us having experienced addiction medicine programs that require urine tests, and for many, these experiences have been unpleasant to say the least. We try to do it differently here. We explain that there are 2 reasons for the test. First, if people are using drugs from the street drug supply, testing their urine lets us get a picture of what's in the current street supply. The second reason is that we can confirm that they are taking the medications that we are prescribing to them. The frequency of the tests is individualized. So here's how it works. Before seeing the nursing staff or their provider, we ask clients to come in and provide a urine sample. After providing their sample, clients go to meet with the nurse or their provider to do their check-in. While the client is doing that, the lab tech uses a point-of-care urine test to check for the presence of several substances, including benzodiazepines, fentanyl, and morphine. Clients are often curious about their urine results and can ask at any time to witness the test being performed or for their results. The results are stored in the client's chart and are reported to the client's provider. Urine toxicology results are never used to punish clients. Instead, we use the results to initiate conversations about using drugs from the street supply and safer substance use. For some, the results help them understand why they have had unexpected experiences when using street supply. It also helps us have conversations about their prescription, like if their current dose is working for them or not.
Hi, I'm the SOS nurse and I see people for the nursing check-in. We ask clients to come in to see us to renew their prescription, and the goal of the nursing check-in is to partly make the prescription renewal quick and easy. We also use the opportunity to discuss new health concerns, screen for any medical red flags, and to follow up on any other medical or social care the client is participating in. Before meeting with a client, I typically review the previous check-in notes and alerts. Alerts typically serve as reminders for upcoming appointments, outstanding tests or referrals, or clinical information to review or reassess at next contact. The previous clinical notes from their physician or nurse practitioner may also relay current concerns or current care goals. When meeting with a client, I begin the visit by asking if they have any new concerns for today's visit, or if they are here for a regular check-in. Depending on a client's goal or priority for the day, this guides the tone of the visit. Some clients may have larger health pieces they would like to briefly discuss, but they do not feel like they have the time today to address them. Others are quite stable and here for a brief check-in. Some folks we work with may have larger ongoing pieces that require some time, such as wound care or coordination of services. And then others present in a state of crisis where we are only able to address acute concerns. The nursing check-in is designed to create opportunities to discuss new health concerns and screen for red flags, which would be escalated to their prescriber to assess in person. Many situations, if there have been no new concerns or red flags, the client's renewal can be released by the nurse, and the client will not need to meet with the prescriber. If there are red flags, we connect them with the prescriber. Red flags that we are screening for include abnormal vital signs, decreased level of consciousness or altered cognition, bowels, constipation or fetal incontinence, overdoses since last encounter, skin concerns, specifically if accompanied by fever, neck pain, or severe pain, hospital visits since last encounter, new or worsening chest pain, shortness of breath, back pain, or joint pain. Back pain if accompanied by fever, bowel bladder incontinence, leg weakness, or saddle anesthesia, pregnancy, suicidal or homicidal ideation, or victim of physical or sexual assault.
Hi, I'm Dr. Andres Sarita, and I'm one of the SOS prescribers on the team. I begin by letting Crystal know I'm reviewing the nursing note written by our nursing team before coming to see me. If I see in the nursing note that her fentanyl use has increased, I'll discuss it with her at her visit with me. I hear from people that their use might go up when they're experiencing stress, struggling with the weather conditions, having nowhere to sleep, and when their bodies hurt from being outside all the time. I often hear people say their fentanyl use decreases when they can sleep indoors, even at the shelter hotels. I make sure people realize that their struggle is valid and no one should have to sleep outside. Next, I'll ask that they walk me through their daily use. So for Crystal, I prescribe 400 milligrams of Cadian as her backbone and 24 dilaudid 8 milligram tablets that she goes and picks up at the pharmacy every morning. I'll ask Crystal how she feels when she picks up those meds in the morning, how long the Cadian lasts, and if it makes her sleepy at all. I'll ask how she's using her D8s right now, whether that's by injection or oral use, how many tablets she uses at a time, how many times a day she uses her tablets, and if she injects all of her tablets or only some. So Crystal might say, for example, she uses 4 tablets in the morning to get unsick from the night before, and then another 4 tabs every couple of hours until she runs out of her day's supply. Crystal might use some fentanyl later in the day, hoping it's going to get her through the night once her safe supply has been exhausted for the day. I really aim to help Crystal avoid relying on drugs from the contaminated, unregulated street supply. I want to determine what changes we need to make in her medications to help make her more comfortable and experience the effects that she's seeking, whether that's withdrawal relief or euphoria or both. Sometimes people feel embarrassed or ashamed if their use has increased or if they're injecting more than they were at the last visit. This is often because of their experiences with programs aimed towards abstinence and programs that have more carceral models. I ensure they know I'm there there to support them in all of their goals, whatever their goals are. Someone like Crystal might find that while she's sleeping outside, injecting actually makes the medications work better for her, and that fentanyl helps her get through the night. I'll also ask Crystal if she wakes up during the night and what causes this. Is she waking up due to pain, or is she waking up due to withdrawal? It can be really hard to know, and often it's both when folks are outside. We'll talk about what would be best, and since Crystal is sleeping rough right now, she actually might not want to sleep all the way through the night, but she does want to be comfortable physically and from withdrawal symptoms. Crystal might find that having a few more doses of D8s for when she wakes up through the night will help her. And I would suggest that when she's back to sleeping inside, that we can look at adjusting her circadian so that she can sleep through the night without waking up to use drugs. Now that we have a plan with her medications, I'll ask Crystal if she's spoken to someone on the team about housing. If she hasn't already, I'll invite her to stick around, get warm, have some food, have a nap, get some socks, and let someone call around to find her a bed. I'd ask that she comes back in a few days to see how things are going with the change in her dose.
Hi, I'm a team member on the SOS team. I'd like to show you our client respite space. Some of our clients come into the respite space so our healthcare team can monitor them a little bit closer for a while. It could be that someone has an injury or that they are sick and want to keep an eye on them and make sure that they are as safe and comfortable as possible. Some of our clients are uncomfortable going to the hospital because of negative past experiences. We are known as a safe place to come so that they can be properly assessed and monitored. We address food insecurities by providing food and information about community resources. When I first started at London InterCommunity Health Centre, I was so pleasantly surprised to see people getting bowls of soup and noodles made for them by our staff. It makes such a difference to someone's day when they are hungry to have a nice warm bowl of soup prepared for them. We also tried to keep donations on site of clothes, shoes, and bags. There are many times during the year that a person will need to change clothes, and we don't want to be sending people all over town to get items that they require, especially when they're not feeling well.
Hi, I'm a member of our social services team. My role on the team is to coordinate complex medical and social care. Our clients are invited to connect with myself or our social team about their goals and care needs. A client might tell me that they are tired of living outside with no place to go. I'll check to see if they have connected with our local coordinated housing access service and if they have completed their housing assessment. We also ask if this person has completed their rent geared to income housing application. I'll ask them about their experiences searching for housing and find out what kinds of barriers they have faced. I'll ask if they need any support to help them maintain housing, like nursing, PSW, or a housing stability worker. We'll talk about what we need to do to help them move forward with securing housing and make the calls to find out the status of their existing applications. But we'll also make sure that they have what they need immediately. We'll call around to find a bed to sleep in. Many places don't have space right away. We can often secure a bed for them in shelter in a few days, but in the meanwhile, sometimes all we can do is offer a tent, blankets, to help them get through the night. We'll make sure that they have clothing and food that they need and a resource list of places they can go to get food and drop-in spaces that they can access in the meanwhile. We'll also make sure that they know that they are welcome to come back and let us know if there's anything else that we can do to support their needs.
At LIHC, our focus is on our clients' self-defined goals and needs. Our goal is to provide a safe, welcoming space where we can build supportive relationships. Our Safer Supply program is built on the values of harm reduction, persistence, and hope.